Joining us now is Nan Hayworth, member of the Independent Women's Forum Board of Directors and former Congresswoman as well, and a great person to have on this topic of Obamacare.
I'm a doctor, too.
Yes, so, and a doctor, of course. You have too many accolades. We can't get them all into one sentence. So let's talk about this for a second. Yeah. You say that it's a good thing that Obamacare signups are down. Now, the Democrats will fight you on that all day long, saying the less people have health care.
Well, you know what we want to see is everybody having health insurance they can afford, Rob. Right. So I think what we can deduce from the drop in Obamacare exchange plan enrollments is that, look, this is the market's judgment. This is the public's judgment on those plans. Obamacare, unfortunately, these exchanges created plans that provide really less than full value for money, and they're very costly.
Right.
So the rising economy has meant that millions of Americans have gone back to work, and a lot of them have been able to get employer-provided health insurance.
That's a good point.
Which is great.
Yeah. But what do you say? I mean, to the people that say that the president and the Republicans have been trying to poison Obamacare, they take away the individual mandates, so now it's not going to be funded. Right. It was looking dicey to begin with, and then it started to make a comeback, Democrats say, and then it just got taken down by Republicans. What do you say to that?
Well, there definitely have been moves that have weakened the appeal or the power of Obamacare in the marketplace. Yep. One of them is that, yes, in the Tax Cuts and Jobs Act, the individual mandate was taken down to zero, basically. It wasn't quite eliminated, but it was taken to zero. And that's definitely prevented people from having that incentive to go out and buy an overpriced insurance policy.
Sure.
The other thing, though, on the positive, and I would call that a positive for people, you know, they're not being forced, young people especially, to pay exorbitant rates for coverage that really isn't terribly good.
That they don't need, probably.
And that they don't need, exactly. With narrow networks, the provider networks are not where they should be. But the other aspect is that the Trump administration has also allowed people to have the option of buying more limited plans at a lower cost. Yeah. And that, too, is taking them away from the exchanges. And again, those exchange plans are loaded with items like, for example, children's dental care for a single man or a single woman. You know, things that they don't need to pay for. So the fact that they're not appealing in the marketplace, again, that's the public's judgment on Obamacare. And it should tell folks who like Obamacare there's something wrong with the law.
Right. You know, I ask you this every time we talk about this subject, and I'm wondering if you see any progress in this department. The Republicans haven't had a very good answer to this question. What are they going to do about health care?
Right. And they should, Rob. They've got some great things happening, frankly, from President Trump's side, on the administration side, to make insurance plans affordable, to provide, to tailor them to people's needs. Association health plans are a great thing for small businesses. They've let small businesses get together so that they have more power to negotiate against big insurers.
That was a good thing.
And it's a great thing, exactly. States are doing wonderful things with Medicaid plans for their citizens, those folks who really can't afford to be in the insurance marketplace.
So you see a plan coming together, formulating, but it's taken more time than it should have.
Well, yes, for a lot of reasons, and with the Democratic majority in the House, it's going to be even more challenging. But President Trump's going to keep working on it from the administration side.
We'll see what happens. Doctor, thank you so much for your time this morning.
Thank you, Rob.
We'll be right back.